Alright, so we'll quickly talk about another concept. This is what is known as the basic calcium phosphate. Basic calcium phosphate. Okay. So basic calcium phosphate is, it just refers to like a group of what? Ultramicroscopic calcium phosphate crystals. So primarily we are talking about what? Hydroxyapatite, Octacalcium phosphate, Tricalcium phosphate. So they are usually implicated in several musculoskeletal disorders. So you're having a disorder in the skeleton and these guys are basically implicated. Alright, especially calcific tendinitis, destructive arthritis, like all those Milwaukee Shoulder Syndrome. Alright, so this group of ultramicroscopic calciums, they are always being implicated in these conditions. So what are they? Alright, so they are non-acidic, alright, calcium phosphate crystals. They are similar to minerals in bones and teeth. So they often form what? Like they form in periarticular, like they are round joints. Alright, they could also be intra-articular within joint tissues. So they are not usually visible under standard polarized light microscope, So conditions, they can be implicated in different conditions like calcific tendinitis, Milwaukee Shoulder Syndrome, then the basic calcium phosphate associated osteoarthritis. So all of them, we'll talk about them in a different video. Okay. So pathogenesis, you should know that they can trigger inflammation, they can trigger tissue damage, they can trigger cartilage breakdown. So they may activate macrophages of fibroblasts, so they can release enzymes and cytokines. They often form at site of tissue injury, metaplasia, altered mineral metabolism. Alright. So diagnosis, you should know that if it is on X-rays, it will show cloud calcification. MRI ultrasound is helpful in dictating soft tissue involvement. The synovial fluid analysis, right, rarely dictates it, but with some special stains, it can actually help to dictate it. Okay. Management, you know that they actually trigger inflammation, so you might want to employ drugs that stop inflammation. So non-steroidal anti-inflammatory drugs and colchicine, corticosteroid injections, needle aspirations, surgery in refractory or destructive cases. So that's just what the basic calcium phosphate simply means.